Is screen visible to everybody?
Yeah. Yes.
Yeah.
Yes,
Good
Sagar.
evening. Good evening, all my seniors, teachers, and my colleagues. Uh, I have made, I have created this. I have actually done multiple workshops on the AV fistula creation and got fellows from every part of India. And this was the module what I have made for the creation of the AV fistula. So today I will discuss the first the modules, and we can always uh, modify them. And one this information that I have left Khyber.
Right.
Now I'm working in the Ujala Cygnus Multi-Speciality Hospital. It's a new corporate hospital, first corporate hospital in the valley. So I'm there as an intervention nephrologist. So this is the outline for the modules. So module one, it will consist of the basic anatomy of the central vessels and the peripheral vessels of the upper limb. Then we'll go to the module two, which will include the pre-operative evaluation of the AV fistula creation, history taking, physical examination, vessel mapping by the ultrasonography, and in the selected cases, for example, the patients having the cardiac devices, this long-term catheters with the on examination showing some vessels in the neck, in around the shoulder, upper chest, or history of the PICC lines, chemoports. So those cases will go further. We'll also discuss the venography and its indication before the creation of the AV fistula. And
Adil, may I interrupt you for a while?
yeah, yes.
This preoperative evaluation, mapping, and I think all this has been earlier covered, and today how actually we start doing. I think you can concentrate on that part.
No, it's not only these are the modules, but
Audio.
we should discuss in the future for the
Yes.
before, in relation to the AV fistula creation. It's not only the creation of the AV fistula, it's just the before pre-assessment of the AV fistula surgical part and the post-operative. So it's like that, what I have made. So
Okay.
we'll go with, we can modify it always. So module three will consist of the setting of the instrument tray. We'll have a detailed discussion on the instruments, what are the instruments used, their parts, how they are used, what for they are used, and how the preparation of the part is done, and how the draping is done for the patient of AV fistula, and how to set up an operation theater, what you require for the AV fistula creation. And module 4 will include the AV fistula surgical procedure stepwise, from the incision to the closure of the wound. And module 5 will have a wet lab practice, multiple anastomosis techniques, and how to prepare the simulation for the AV fistula anastomosis. And module 6 is that will have a immediate intraoperative and the post-operative complication, and how to manage those complications, and the post-operative care. And the module 7 will include the cardiac and the hemodynamic change with the AV fistula creation, and the what is the how vessels, there's a remodulation of the vessels post AVF creation, the positive remodelation, the negative remodelation. And the module 8 will have a clinical evaluation of AV fistula maturation by USG Doppler, and the physical examination also, and the surveillance of the AV fistula. And the module 9 will have aspects of the cannulation, use of USG assistance for the first cannulation, types of needles available and their advantage, needle size and direction of the cannulation. And the module 10 will have chronic complications of post-op AVF creation and their management. So today we'll discuss the first module.
Adil?
Yes, sir.
Yes. Yeah.
Yeah. So
I
this
think
is the
module
module
3 would be a good starting point. Anyway,
module 3.
yeah.
Shall we discuss the central vessels?
No, no, show the module 3.
So
Because now the audience today are focused on, how to start doing it. Yeah. So setting up instrument tray, part preparation, operation theater, instruments, and,
but what I have prepared is the module 1.
what is module 1?
It is the central vessel, central and the peripheral vessels. So it is a detailed vascular, arterial, and the I we all know the vessels, but this will enlighten us and it will give the more insight in the topic.
Oh,
So we can go step by step. I think so.
okay. Yeah.
Hello.
Yeah.
Okay, sir.
Now that you are prepared, because what I had in mind was, they have listened to so many, lectures on various aspects, but doing it, in detail, because one go we have shown them doing AV fistula from, incision to closure. So, but anyway,
Yeah,
okay, yeah.
this always available on the YouTube, and we have a lot of videos for that. But what I want to discuss that what are the different vessels and how to do the ultrasonography, and then the instruments, so that this will be the live or the what we have Vail sir and me, we may have the in combination that the instruments we can show in this meeting. What are the different instruments, and we'll have a short videos from the OT. So
Okay,
that way it will be more interesting.
okay, go ahead.
So I'm starting the module 1. So module 1 is the basic anatomy for the dialysis vascular access. So this picture is showing that the
But you haven't opened that file set.
I have shared also. Can you see my screen?
Yeah, we are seeing module 3 slide. What about others?
Oh, 1 second, sir. 1 second.
Yes, sir. We are seeing the modules we slide.
1 second. Now?
No, now we see you. You'll have to share.
Okay.
Share that PPT.
Is it visible now? Can
No.
you see, sir?
No, Adil.
No?
No.
Okay.
Share screen.
Zoom. Your screen. Basic anatomy. Here. Now, is it visible?
Yes. Yeah.
Okay.
Yeah, start.
So I'm discussing today the basic anatomy for the dialysis vascular access. So this is the rib cage. This is the sternum, clavicle, first rib and the second rib. Sorry. And behind it is the central vessels. So the central vessels are those vessels which are in the rib cage, or which are covered under the bones. So the visibility directly from the ultrasonography is difficult. So there's a formation of the from left ventricle. There's a formation of the aorta, and the aorta there's an arch of aorta, and from the arch of aorta there's a it gives the branch to the arch of aorta, gives the branch on the right side, and it gives the 3 branches. What we discussed is the aorta. This is the arch of aorta. It gives the first branch on the right side. It is the brachiocephalic trunk, which further divides into the internal common carotid artery and the subclavian artery, which further continues as a axillary artery. On the middle, it gives the common carotid artery for the left side of the neck, and the third branch is the subclavian vein on the subclavian artery, sorry, on the left side, which continues as the axillary artery. So this is in the neck, this is the carotid sheath, which contains the carotid artery, the internal jugular vein, and the vagus nerve. This is a neurovascular bundle in the neck. And then from the first clavicle, from the clavicle, beyond the clavicle, the subclavian artery, it continues as the axillary artery. So the axillary artery has three parts. So the pectoralis minor muscle, it divides the axillary artery into the three parts. The first part, the behind it is the second part, and the third part, which gives the multiple branch to the thorax and the scapular region. And the axillary artery from the lower part of the teres major muscle, it continues as a brachial artery. And the brachial artery gives multiple branches to the arm muscles, and it gives the collaterals, which join to the collaterals of the ulnar artery and the radial artery. So it runs in the medial aspect of the arm along the median artery and the basilic vein. So this is the brachial artery, which is, there are two brachial deep veins along with it, and the median nerve, and also adjacent to it is a basilic vein. Sometimes what happens that there's an anomalous artery. So from the upper part of the brachial artery, there's a formation of there's one more branch. This is known as the accessory brachial artery. It is formed at the upper part of the brachial artery, and it rejoins it at the lower part before the bifurcation of the brachial artery. It rejoins the brachial artery. So this variation is up to 1 to 3% of population, and sometimes this may be the cause for the non-maturation of the AV fistula, and it's more superficial to the brachial artery. So on dissection, we found this artery and joined the cephalic vein to this artery. So this should be kept in the mind, and pre-assessment, it will show the two arteries. One will be the smaller arteries and one will be the bigger artery. So we have to take in consideration that this may be one of the cause for the non-maturation. And then the brachial artery divides into the two. One is the radial artery and second is the ulnar artery on the medial and lateral side, which gives the multiple collateral branch, which rejoins the collaterals of the ulnar artery, this brachial artery. So the same thing. And in the wrist, the ulnar artery, they divide into the deeper branch and the superficial branch, and the superficial branch gives the distal arteries, and it joins the superficial branch of the radial artery, and also it gives the deeper palmar arch, which is joined by the deeper branch of the radial and the ulnar artery. So this is the ulnar artery, which gives the superficial branch, and the blue one, this is the deeper branch. So deeper is below the tendons, and the superficial is above the tendons, which gives the palmar arch, which gives the distal branch. So what is the importance of this arch is that the fistula, what we create here, it gets the blood from this arch and blood from the radial artery. So the radial artery and the ulnar artery. So if there is a problem with this arch, so in Allen's test, we see the patency of this arch. So one, there will be the hypoperfusion or ischemia to the digits, and second, there will be less flow to the AV fistula. It is the same thing. So one, this is the deeper branch. This gives the deeper palmar arch. This is the superficial palmar arch. So now the veins, the arteries, they break down into arterioles, and then there will be the capillaries, and there will be the venous formation. So the veins, what this is called as a digital veins, dorsal digital veins. These are the superficial veins. There are two types of veins. One is the superficial set of veins, and the second is deeper set of veins. So the superficial veins are formed. So digital veins, they join and form these are the dorsal distal veins. They form the dorsal metacarpal. These are the dorsal metacarpal veins. So the dorsal metacarpal veins, they again join and form on the medial side the basalic vein. On the lateral side, they form the cephalic vein. And on the palmar side, the digital veins, they join and the palm and form the endocubital vein. So there are three veins. On the medial side, there is a basalic vein. On the middle part of the forearm at the wrist is the median endocubital vein, and the lateral, there will be the cephalic vein. So this is the median endocubital vein, this is the basalic vein, and this will be the cephalic. So cephalic vein, it runs on the lateral border of the forearm, and the medial border of forearm, there runs the basalic vein. And they form the straight course till they reach the cubital fossa. So this is the picture. It's the antecubital vein which joins the median cubital vein at the cubital fossa. This is the cephalic vein, which also joins the cubital vein, and the basalic vein, which also joins the median cubital veins. So there will be a lot of variations at the cubital fossa. So this one is the cubital vein, this is the antecubital vein, this is the cephalic vein, and this is the basalic vein. They are interconnected with each other with the median cubital vein. So the median cubital vein, so when we go for the ultrasonography of this portion, we have to see the outflow. For example, we have to make the radiocephalic fistula. So we have to see the outflow of the cephalic vein. Is it the cephalic vein of the arm, or is the basalic vein of the arm? Whether the blood will be taken by the basalic vein predominantly, or the cephalic vein, or the both. So there will be the variation. There are some variations that the cephalic vein directly joins to the basalic vein, or it may continue as a cephalic vein of the arm. And the cephalic vein, it goes on the medial aspect of the lateral aspect of the arm, and it runs in the deltopectoral groove and goes into the and passes the clavipectoral fascia and joins the axillary vein and forms a curve which is known as cephalic arch. And the basalic vein, it runs on the medial aspect of the arm and goes deeper to the deeper close to the bone, and it is joined at the upper or the middle part by the deep veins of the brachial veins, deep veins of the brachial artery, and it forms the axillary vein. This is the basalic vein. This is the basalic vein joined by the brachial veins. The brachial veins, and there's a formation of the axillary vein. And this is the deltopectoral groove in which the cephalic vein runs. So this is the deltoid muscle. This is the pectoral muscle. This is the deltopectoral groove. This is the this is a clavicle, and this is the pectoralis muscle. There's a fascia. It passes this fascia, which is known as clavipectoral fascia. So the highest the incidence of the cephalic arch stenosis is due to this fascia also, and its curved nature, and this portion has more valves. That is why the cephalic arch is more prone to get stenosis. This is the cephalic arch, which the cephalic vein forming the arch and joins the axillary vein. When it joins the axillary vein, this is the cephalic, this is the basalic vein, which is joined by the deep veins of the brachial veins, which forms the axillary vein, joined by the cephalic vein, which forms the this is the subclavian vein. So the when the at the point the cephalic vein joins the axillary vein, then there's after that there's a formation of a subclavian vein. So this is the subclavian vein, which is joined by the cephalic arch. This is the subclavian vein, and then the subclavian vein is joined by the internal jugular vein and forms the brachiocephalic vein on the both sides. So there's the internal jugular vein, there's the cephalic arch, cephalic vein, there's the axillary vein, and this is the formation of the subclavian vein, which is joined by the internal jugular vein, and there's a formation of the brachiocephalic vein. The opposite brachiocephalic vein, when joins the right brachiocephalic vein, forms the superior vena cava, which joins the right atrium. This is the same thing. The brachiocephalic, both sides, forms the superior vena cava. This is the external jugular vein. This is the external jugular vein, and it joins. It has some curve and joins the subclavian vein. When there's a stenosis or the thrombosis of the internal jugular vein, this portion, then we may have a access the central vein from this vessel. So there's the external jugular perm cath or the temporary catheters we can put in cases of the thrombosis or stenosis of the internal jugular vein. So this is again the same thing. So at the lower end of the superior vena cava, there's the vein that is known as the exiguous vein. This is the superior vena cava. At the lower border, it is joined by one vein that's known as azygous, and it has some arch. Sometimes your guide wire goes in the azygous vein, or else we may have the catheter in the tip of the catheter in the azygous vein. So this vein, should know this vein. There's intercostal veins, they join and form a trunk. This is known as azygous vein. And on the left side, there's the intercostal veins, they form the hemiazygous vein. And from the brachiocephalic vein, there is an accessory hemiazygous vein. So above, it's a hemiazygous vein, accessory hemiazygous vein, and below the hemiazygous vein, which joins the azygous vein. On the right side is the azygous vein. On the left side is an accessory hemiazygous vein and the hemiazygous vein. So there are deep branches. They run along the arteries and form there are pair of veins. This is known as the ulnar vein, and this is the radial vein, and they run along the arteries and form and join at the cubital fossa, join the superficial veins. So there's a connection between deep and superficial veins by the connecting veins at the cubital fossa. These are the brachial veins. These are the brachial veins, pair of the brachial veins, which run along the artery till it joins the basalic vein and forms the axillary vein. There's a femoral veins. We are not discussing those veins at this time. So this is the fluoroscopic picture of the arch of aorta, from where the brachiocephalic trunk forms, and it gives the branch common carotid artery and the subclavian artery. And in the middle, it gives the common carotid artery, and on the left side, it gives the subclavian artery, which runs then as an axillary artery. This is the brachial artery, which breaks into the ulnar artery. The bigger one is the ulnar artery, and the continuation of the brachial artery is the ulnar artery, which is bigger and more in diameter. And then on the lateral side, it gives the one more branch, which is known as ulnar artery. This is the radial artery. This is the same thing. There's a bifurcation, ulnar and the radial artery, and sometimes the extracerebral artery. This is the origin of the extracerebral artery, and it rejoins the lower part of the, before the bifurcation, it rejoins the back the brachial artery. So this should be always considered in mind before creating the AV fistula. So it's a palmar arch. This is the radial artery forming the superficial branch and the ulnar artery, and there's a continuation of the. They give the digital branch. They give the digital branches from the deeper end, the superficial palmar arch. This is the basalic vein. This is the basalic vein. This is the appearance of basalic vein, and the valves. There's a more uptake of dye or the stasis of the dye at the site of valves. So this is the cephalic arch joining the axillary vein, forming the subclavian vein. So this is the left brachiocephalic vein, and it will join the opposite brachiocephalic vein, forms the superior vena cava. This is the same thing. Sometimes there's a multiple cephalic arch. There are two or accessory cephalic vein at the site of the, when it joins the axillary vein. This is the same thing on the right side. This is the visible internal jugular vein, subclavian vein, cephalic arch, axillary vein, formation of the brachiocephalic vein and the superior vena cava. And this is the central veins of the lower limbs. Thank you.
Adil, I think I feel bad for having interrupted you in the beginning. I think it was very, very important that you described all these variations and thing, which is very necessary before taking up AV fistula. Because
okay. Thank you.
Especially the accessory brachial artery, when I came across it for the first time, I didn't know about this, and I was wondering why the brachial artery is so small, and what if I anastomose, and if this, sort of thrombosis or something, then what will happen to the limb? And I was imagining so many things. So later only I learned about it, and it's glad you made it very clear for the early takers. And also the early branching of the brachial artery into radial and ulnar sometimes can pose a problem. You create a brachial fistula, and later when you are trying to intervene in the cath lab for some intervention, your radial artery will not reach the anastomosis.
Exactly.
So you understand that.
So you have to go through the ulnar artery at that time.
Adil,
or you have to
stop sharing your slides so that we can see everybody. I think slide is on.
my screen is on.
Yeah.
You unshare,
Okay.
yeah, it will go off.
1 second.